Hey guys, we've just had this huge announcement in British Columbia that they are going to be moving away from Pap tests over to HPV testing. Let's talk about that. So HPV, or human papillomavirus, is the virus that causes cervical cancer. Now, how it does that is that in some small percentage of women, this virus, which is really a sexually transmitted infection, it's found in about 80% of people who are sexually active, the virus gets into the body, and instead of being cleared by the body, it causes a chronic infection. And over several years, often 10, 15 years, it transforms the cells in the cervix first into precancerous or dysplastic cells, as we call them, and eventually into full-blown cancer. And so what we do to detect that conventionally is a Pap test. And you take a brushing or scraping of cells from the cervix, you look at them under a microscope, and if they show those precancerous changes, then you can make interventions to prevent that full-blown cancer from occurring. And Pap tests have been around since the 1940s, and they haven't changed much, but they have effectively reduced cervical cancer rates. The question is, now that science and technology has advanced, why look for those pre-malignant cells when you can just look for the virus itself? And that's what this test is doing. So this is the advance that we've had. Instead of having to scrape and do a Pap test, you can actually do in this case, self-test for the virus itself. And what's nice about this is that women can actually do this at home on their own. They can actually order the kit and then mail it in and get their results so that it's much less invasive. It doesn't rely on having access to a healthcare professional who can do this for you. For a lot of women, there's a discomfort level with getting this done. We know that, for example, people in LGBTQ communities are less likely to get their Pap test done. First Nations communities often have issues with trust with the Western medical system based on their history with the Western medical system, and they often have lower uptake of Pap tests. And there have been studies in the US and even the pilot study that was done in BC that shows that, in fact, this self-testing results in a higher screening rate. It's also more accurate. So instead of a Pap test every 3 years, you can actually do this test every 5 years, which ultimately is less testing and might actually save the healthcare system some money. So this is another great advance for cervical cancer prevention. Of course, the best way to prevent it is to prevent the virus from ever getting there, and that's why we have this amazing HPV vaccine. That vaccine was approved in 2006, been around for almost 20 years now. Getting the HPV vaccine is very easy. It's part of the routine immunization schedule for kids across Canada. In every province and territory, kids between 9 and 15 can get the vaccine. If you have the vaccine, it very effectively prevents the virus from taking hold and therefore prevents those precancerous changes and eventually prevents cervical cancer from occurring. And that's been seen in countries around the world that have HPV vaccination programs. So between the vaccine and Pap tests and HPV virus testing, here's hoping that we can actually eradicate cervical cancer in this country in the next maybe 10 to 15 years.